You had your vaginoplasty procedure and now you know what to expect. Now remember, right after the procedure, the area is going to be swollen, it will be bruised a little bit, and it will be tender. You just had a procedure, right? So it's going to be. So the swelling is more pronounced for first 2 to 3 days after the surgery. So really important to use cold compress, ice bath, at least 2 to 3 times a day to help with the swelling. It also helps with the pain control. The bruising and the tenderness will also go back slowly. It takes about a couple weeks or so, but really important to use that ice pack. The pain after procedure is not too bad. It's more like a discomfort than a pain, and it is very well controlled with over-the-counter medications. You will be given a prescription for pain medication in case there is a breakthrough pain. Now remember, if you use a lot of prescription strength pain medication, it can cause constipation. It has a codeine in it which can cause constipation. We don't want you to be constipated, because if you're constipated and if you're straining, it can give more extra pressure or strain on the stitches and they can pop. So really important to avoid constipation. Please get some fiber supplements, get stool softeners, hydrate well, and avoid straining during bowel movement. Hydration is really important also, not only for tissue healing, also for constipation. You will be given antibiotics after surgery. This is a vaginal procedure and vagina has bacteria, so we worry about any infection later. So please take your antibiotics as they have been prescribed to you to prevent any infection in the future. Now, if there is no infection, the healing is usually beautiful. You don't even see a scar line there left. But if there is an infection, then you're going to have scarring. So please avoid that, okay? You will be also instructed to dry for the first week after the procedure, to try to avoid that. If sitting down is a little difficult for you, use like a donut or something, or sit back. If you have to, sutures take about 2 to 4 weeks to completely dissolve. So it's really important while the stitches are there to keep the area very clean. So every time you go to bathroom, make sure you wash the area with some warm water. Use a peri bottle, wash the area and dab it. No scrubbing the area, no scratching it, nothing like that. Now talking about scratching, as the stitches start healing, you're gonna feel itchy down there. Okay, the stitch, it gets dry, it pulls and it gets itchy. So please avoid any kind of scratching or itching in that area. Keep the area moisturized if you can, and that will help with the itching. It's really important to keep those stitches nice and healthy, because if they are healthy, they heal good, the incision is gonna look beautiful. So make sure you really take care of it. So taking care of it also includes avoiding any kind of heavy lifting. We don't want any straining on that tissue while it's healing. So no heavy lifting for 6 weeks, no swimming for 6 weeks, and no sex for 6 weeks or so. Okay, even if the sutures fall off in few weeks time, don't attempt sex, because those are the outside stitches. The inside stitches, which are holding your muscles together and tightening them, they take about 6 to 8 weeks to heal. So let them heal completely before you attempt any of the above things or so. We would tell you not to drive the first week, so make some arrangement if you need to. We'll tell you that you can go back to work in about 2 weeks or so. We see our patient a week or two and 2 weeks later after procedure, and if they are okay to go back, then you will get released to go back to work in about 2 weeks or so. You'll be asked to start doing Kegel exercises before the surgery just to help you get into the habit of it. 6 weeks later, not during that first 6 weeks of healing, but 6 weeks later, it's important to start doing those exercises again. Now you have this nicely tight muscles. You want to maintain that tone of the muscles, right? So that it will continue to be tight and help you with the sexual sensation. So Kegel exercises should be done at least daily for first 6 months, and then 3 to 4 times a week following that. Really important to follow that advice. Sometimes if the vagina is too tight and narrow and it's a little uncomfortable during sex, we will tell you to use some vaginal dilator, and we'll have that conversation, how to use it, which ones to use it, all that at your 6 weeks appointment. So surgery, if you take care of it well, will heal beautifully, will have very minimum complications, and you will be really satisfied.